welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Confirmed COVID-19 cases in Nigeria almost double in 24 hours as the country records over 1,400 cases. State Secretariat at Dutse, the Jigawa state capital, sealed to unvaccinated workers. And all non-residents from Britain to give plausible reasons for travelling in. Thank you for joining us. Nigeria recorded one of its highest single-day count of infections last night. The NCDC last night said the reports were from 14 states and the Federal Capital Territory, with Lagos recording the lion's share at almost 800 cases in a single day, showing a dramatic rise in the evolving fourth wave. Now, here's a report on the COVID-19 update.
1,424 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported for 14 states and the FCT, indicating a significant jump from the figures reported 24 hours earlier and almost quadruple the figures reported 48 hours earlier. Lagos highest number of infections by far, with 796 cases, more than 5 times Delta's 155 case count. The FCT recorded 130 cases, while Edo logged 129. Oyo led the double-digit pack with 82 cases. Ondo and Rivers recorded 39 cases each, while Kaduna closed the group with 15 cases. Enugu had 9 cases, while Anambra, Kwara, Ogun, Bayelsa, Kano, and Akwa Ibom registered progressively less cases. Akwa Ibom closing the single-digit group with 3 infections. The new tally has increased the total confirmed cases in Nigeria to 220,020. The report also includes 0 cases from Bauchi, Ekiti, Osun, and Zamfara states. 38 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 211,292. There were no additional deaths resulting from COVID-19 complications in the last 24 hours, leaving the fatality toll at 2,983. Currently, there are over 5,000 active cases in Nigeria, while over 3.6 million samples have been tested so far. More than 8 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 4 million persons have been fully vaccinated. In Africa, there are more than 8.9 million confirmed cases and over 225,000 deaths have been recorded across countries on the continent. The total global confirmed cases have surpassed 272 million, while deaths are beyond 5.3 million.
And over to Dutse local government, the state capital Jigawa, they've sealed their secretariat against unvaccinated patients. The local government chairman, who also doubles as the chairman of the Association of Local Government of Nigeria, Jigawa State Chapter, disclosed this to Channels Television. According to him, his staff must choose between their work and getting vaccinated. Our correspondent Sadiq Iliasu has more.
As the world is witnessing another outbreak of a new variant of COVID-19, authorities are taking steps to curtail a possible spread of the Omicron variant in Nigeria. In Dutse, the Jigawa state capital, the local government secretariat is sealed against unvaccinated staff. However, vaccines are provided at the gate for those who change their minds and decide to take the jab. The local government chairman, Balachamo, is optimistic that his staff will prefer taking the vaccine than getting prevented from doing their work.
To intensify our campaign to make people understand the effectiveness or the value of these vaccinations, which I think they look at my sub-staff, even the messengers here, they were rushing to take them because they've seen me taking it. They've seen the vice chairman, they saw the speaker took this particular vaccine. So certainly they believe, yes, since all of us can avail ourselves for this immunization, there isn't any reason whatsoever for them not to take. And we say, even as much as you think you can come without that, please excuse us. We are protected, you should also be protected. So one of the measures actually is to make sure everybody understand the value and everybody understand this is a commitment we can put in place. The governor has done that in the public, the deputy governor has done that in the public, the president has done that, all their family households have done that in the public. So certainly everybody should understand we are committed to this.
Jigawa State is ranked among the top 10 states in COVID-19 vaccine reach. Out of 619 patients, it has discharged 600 and has only 2 on admission. With efforts like this, state officials are hoping to stay on top of the situation with as few casualties as possible.
COVID-19 has taught Nigerian universities to break bounds and exploit the options technology has to offer. The Vice-Chancellor of the Ekiti State University at an event to chronicle developments and revolutions achieved by the institution in 40 years says that with the innovations occasioned by the pandemic, the university is perfecting plans to allow students present seminars and defend their thesis virtually from any location across the globe.
Virtual learning has come to stay here in Etu. It will be interesting and which you can confirm. You can confirm. I teach chemistry, and one of the courses I teach is Chemistry 301, offered by chemistry students, SS students. You can just as freshman can ask them. I teach them virtually online, usually in the night. Sometimes time from 8 p.m. and sometimes we go end on 10 p.m. And even when I was outside, I was teaching, I was interfacing with them, I was interviewing my students. So it's a technology which ordinarily, if not, that's why I've always told some people, COVID-19 has both positive and negative components. So we are trying to improve on the positive components, and we're even going a step further, in our university, that all stops our students from even presenting their seminars, defending their thesis. By now you come to Adoekiti here, wherever you are.
Talking about the new normal. Well, over in Katsina State, the governor, Aminu Masari, his deputy, Mania Yakubu, and some members of his cabinet have received the COVID-19 booster shots at the Katsina Government House. The executive secretary of the state's primary health care development agency, Dr. Shamsuddin Yahya, who administered the vaccines to them, says the jabs have the capacity to strengthen the body's immune defenses. He expresses optimism that the booster shot will go a long way to preventing another wave of severe disease driven by the Omicron variant. Well, for more on what is happening around the world, especially in Nigeria, the evolving fourth wave, joining us to talk more about this, he joins us from our Abuja studio, Dr. Kiala Isahaku, a virologist. Thank you for joining us on the program.
Thank you, Melissa, for having me.
First, I'd like to get your view on the Lagos state government, which is concerned about the rising cases and says that it started prosecuting inbound international passengers who failed to submit themselves for day 2 and day 7 PCR tests, as mandated by the guidelines. Do you think that that measure will deter a full-blown fourth wave?
Melin said we are already in our fourth wave. Epidemiologically, this is exactly 1 year today that Nigeria was officially declared the COVID-19 pandemic second wave. It was declared on the 17th of December 2020, and today is 16th. If you look at the number of positive cases yesterday, you will agree with me that there is increase in a number of active and positive cases. It is a pointer that there are seasons, festivity are drivers for most of these transmission dynamics. So you find out that we entered into our second wave when we are approaching the festive season last year, and we are seeing similar characteristics again, being revealed. So people traveled a lot. This festive season, we have international travelers coming in. We have even local travelers, people traveling back to their homes for the festive season, for the Christmas season. What we shall be expecting in few days to come is a full-blown increase in the number of cases. This is because a lot of people still don't adhere to the non-pharmaceutical measures. So I agree with the Lagos State government. It is quite key. One of the things that we have not yet achieved, we have a poor enforcement of inbound travelers. You cannot, you travel to the UK, you travel to the US, you have been quarantined for 14 days. But in Nigeria, when you just come in, people say that you go on self-quarantine, and the next thing you see the person on the street, associating with friends. So we must look for a way around getting enforcement to be, if you go to Rwanda, you will be tested not on the second day or not on the seventh day. In Rwanda, you will be tested every day. This is how you achieve active surveillance and contact tracing. So I agree with Lagos State. We need to enforce, because this festive season, people will travel all over the world to Nigeria, and we shall be experiencing systematic Omicron variant community transmission.
So what do you think we should do? And this is for especially the unvaccinated inbound passengers now. Anyone testing positive for COVID-19, the rule book says that they are to, self-isolate at home for 7 days. So if we do not have the competent monitoring, surveillance of these guidelines in the first place, how can we achieve stopping the spread of the virus?
I agree with you, but we can adopt technology, just like the way it is done in the United Kingdom. Your phone number, your phones are being enabled by GPS to be able to track whether you are doing self-isolation or not. We have that kind of platform for monitoring in Nigeria. We can actually do that. We can also see to how we can leverage on inbound travelers, those that are not vaccinated, to take vaccines at the airport. We can see to how we can advance that advocacy, coordinated, robust advocacy to that regards. So I think it is key for us to do that, and we should also be able to bring in technology to be able to monitor people on active surveillance. In fact, I am a proponent of self-testing, despite we don't have it in our national guideline. But we should encourage self-testing and create platforms for people that if they tested positive, they should be able to, submit their results online through several platforms, so that they can, be able to be attended to in terms of care. So I think it is quite key that a lot of inbound travelers need to take vaccines at the ports, at the airports.
It's also, down to a lot of taking personal responsibility, really, to fight the virus. Perhaps I should ask this, now we mentioned vaccination. States appear to have different levels of completion, and this is, in their quest for mass vaccination. What do you think is happening? And this is at the state level.
Yeah, I think vaccine hesitancy, it is by default becoming part of the normal norms in Nigeria. This is because COVID-19 came with a lot of fake news, a lot of misinformation, and vaccine hesitancy, vaccine acceptability, and vaccine uptake is being impaired by this misinformation. And so you will see that a lot of states are doing well, while a lot of states have not yet actually, break the cycle of vaccine hesitancy. My take here is this: we just need to have a conversation on a coordinated advocacy. We should find a way, to tinker with why are states not performing well when it comes to the issue of vaccination for COVID-19. I was actually looking at the vaccination landscape for Nigeria, and I discovered that a lot of states have not even met up with 2% of their population being vaccinated to achieve herd immunity. So I think it is quite key that we need to go into robust advocacy and to be able to reach out to stakeholders, to be able to have the buy-in. And another thing again is that a lot of Nigerians have lost the trust quotient on the administration of the present government, and so those trusts need to be rekindled, and then we do a lot of mass advocacy. That will go a long way for states that are far left behind.
All right. We always appreciate your time on the program. Many thanks, Dr. Kiala Isahaku, virologist. Thank you for joining us on the program.
Thank you for having me.
Still to come on the program, all adults now have to be vaccinated to enter Ghana. We have that story and more when we return. Welcome back. Ghana will fine airlines $3,500 for each passenger who arrives in the West African country without being fully vaccinated against COVID-19. It's the latest measure taken by the country with some of the strictest restrictions in the region. Airlines also will be penalized the same amount for passengers who did not fill out a health declaration form before boarding their flight to the international airport. While Ghanaians who fly in without meeting the requirements will be allowed to enter the country and undergo a 14-day quarantine, foreigners may be refused entry. The new penalties come a day after Ghana began requiring all passengers over the age of 18 to provide evidence of full vaccination against the virus, saying that about 60% of the total new cases recorded in the country had come from the airport during a recent 2-week period. Meanwhile, Ghana's land borders are to remain closed indefinitely to prevent a potential fourth wave of the virus. President Nana Akufo-Addo made the announcement in a national address where he says the government is monitoring the level of threat of the disease and also ongoing vaccinations in neighboring countries before it can reopen its borders. All away from Africa, the island state of Malta, located in the Mediterranean Sea south of Sicily, in November also placed a temporary ban on travel from some of these southern African countries, including South Africa, Namibia, Lesotho, Botswana, Eswatini, and Zimbabwe, in the wake of the Omicron variant, also called the B11529. Dr. Adediran Adelekon is a medical doctor, and he joins us from Malta about the latest there. Hello, Dr. Adelekon. Thank you for joining us today.
Thank you for inviting me.
Tell us, how is Malta doing in terms of handling the pandemic?
I must say, Malta is doing great. Malta has the highest vaccination record in the world. Over 80% of the population are fully vaccinated, and even with the booster vaccination, we have over 30% vaccinated.
So in terms of that, when you talk about the age now, how young can one be vaccinated in Malta?
Yes, I'm not familiar with actually the age. For those who qualify for the vaccination, I don't practice with pediatrics, but I'm actually curious to know which age group actually is allowed to take the vaccination, because I'm not aware of studies involving children for the vaccination.
So talk to us then about some of the countries in Africa which were placed on the ban. I know that Malta did place some southern African countries on the ban due to Omicron. Has anything changed? I mean, you must have heard the UK, for example, has made a U-turn in that regard.
It is worth mentioning that Nigeria is one of those countries that is banned from traveling to Malta at the moment. It's the dark red zone country. So to travel to Malta now, you would need a special travel authorization, which is rarely granted. And even if you get the authorization, you'd have to have a negative PCR and, of course, electronic passenger locator form. And also, you'd have to quarantine for 14 days when you are here. I remember a friend of mine, his mom came to visit him, a colleague, a doctor also, she was not aware of this, and she had to return to Nigeria after arriving in Malta.
All right, talk to us then. I mean, Omicron appears to be a variant of concern all around the world. What are the current levels in Malta at the moment?
Can you repeat yourself? What are the current what?
Levels of the Omicron variant in Malta, which is really one of the reasons why some of these countries came up with the ban in the first place.
Oh, okay. Of course, Omicron is a variant of concern. According to the Technical Advisory Group on Evolution of Virus, it's concerning. On a daily basis, we, at least in Malta, today alone, we have over 167 cases. We've not placed number to which is from Omicron, which is from the Delta, which is, but in total, we've had, on the average, about 100 new cases. In total, we've had 40,000 cases of COVID positive people. Over 38,000 have recovered. Just about 400 have died. And about 2,000 active cases in total.
Finally, before we let you go, Dr. Adeleko, and this is with booster shots. Has that started in Malta?
Yes. Over 30% of the population now have the COVID booster, including myself. So I encourage people who are privileged to get the booster vaccination to get it.
All right, we appreciate your time. Thank you so much for joining us, and do stay safe. Dr. Adediro Adeleko, a medical doctor in Malta. Thanks again for joining us.
Thank you for having me.
France is tightening COVID restrictions for travellers arriving from the UK as the government in Paris tries to slow the spread of the Omicron variant. Now, from Saturday, most travellers who are not French residents or citizens must give a compelling reason. Some lorry drivers and students will be able to travel, but Brits visiting relatives are not currently listed. Here's more on the global update.
The French government says from Saturday, all non-residents from Britain would have to give a compelling reason for traveling to France. All arrivals would have to provide a negative COVID test, less than 24 hours old, and isolate for at least 2 days. The UK recorded 78,610 new COVID cases on Wednesday, the highest number reported since the start of the pandemic. Slightly more than 10,000 have been confirmed as Omicron, but it's thought that about twice that number are cases of the new variant. Italy has also introduced tougher restrictions for travelers arriving from the EU countries, with entry requirements even for those double vaccinated, now needing a negative COVID-19 test before they enter. Non-vaccinated EU travelers have to quarantine for 5 days on arrival. The restrictions will stay in place until January 31st, 2022. Away from Europe, South Korea says it will reinstate stricter social distancing rules a month and a half after easing them under a living with COVID-19 policy. Curbs will return from Saturday to January the 2nd, limiting gatherings to no more than 4 people as long as they are fully vaccinated, and forcing restaurants, cafes and bars to close by 9 p.m. Unvaccinated people can only dine out alone or use takeout or delivery services. Indonesia has identified its first case of Omicron coronavirus variant in the person who has no history of overseas travel. The health minister says there are 5 more suspected Omicron cases, including 2 Indonesians who had recently returned from the United States and from Britain, and 3 Chinese nationals currently in quarantine. Canada's government has implored its residents not to leave the country as provinces ramp up vaccinations to combat the fast-spreading Omicron coronavirus variant.
So today, I have the task of confirming that our government is officially advising Canadians to avoid non-essential travel outside Canada. To those who were planning to travel, I say very clearly, now is not the time to travel. The rapid spread of the Omicron variant on a global scale makes us fear the worst for Canadians that may think of traveling. traveling Canadians could contract the virus or get stranded abroad.
Canada already has travel bans on 10 African countries because of concerns about the new variant. And finally, thousands have marched in New Zealand's capital, Wellington, to protest against COVID-19 vaccine mandate and lockdowns as the country reached the 90% fully vaccinated milestone. New Zealand's tough lockdown and vaccination drives have helped keep coronavirus infections and related deaths low. But it has also drawn criticism from some, calling for more freedoms and an end to mandatory vaccine requirements.
And we have more of those stories and updates, also a better understanding of the pandemic on our website. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Nwonka. Stay healthy.